Thank you very much for the invitation to present. I do not drink coffee. So these are my disclosures. So both Dr. Lebres and Dr. Real talked a little about stress and how that impacts our performance, and I do want to make a few iterative points because the evidence is there that stress impacts our fine motor skills, coordination and dexterity, attention and concentration, our emotional state, communication skills, decision-making. And it's important to recognize that residents who are less experienced are particularly susceptible to stress in the OR and may be uncertain how to cope with it. Dr. Alvarez made this point, but repetition is good for learning, so I'll repeat some of the things he said. So the response to stress, so stress is not the same as was mentioned. It has to do with the interaction between the physiological response as well as how you, the individual, appraises that stimulus that may be perceived as stressful. So that is really what determines whether a stimulus that you're dealing with may be perceived as eustress or good stress, as was mentioned, or distress, which is something that can affect your performance. And the catastrophe model of how stress affects performance is similar to what was presented to you, but this is kind of a three-dimensional picture to depict, essentially, that it's not just the physiological aspect, it's also the cognitive anxiety that we all have. And whenever any of these exceeds a particular level, your performance deteriorates. That's a human phenomenon. It's not specific to surgery, it happens to everybody. So when our performance deteriorates, as was also mentioned, typically patient complications may increase. We did survey a few years back about 100 surgeons, half of them attendings, half of them trainees, about sources of intraoperative stress, strategies they're using, and the impact on their performance. And we found that what stresses most people, most surgeons, is the case complexity, if they have poor assistance, if they're dealing with an operation they've rarely performed before, and it can also be, to a lesser degree, time pressures or technical challenge. What was interesting in that survey was that 40% of our responders had, and they were ortho and general surgery attendings and trainees, they had witnessed a complication in the operating room that they directly attributed to the stress of the operator. So, and about 80% of them desired to have stress management training. So, going back to the previous picture you saw, there is what we call an ideal performance state that we all have. It's specific to you. It's not the same for everybody. But there is a performance or a cognitive state where you perform the best. And that can vary significantly from individual to individual. For some, they may perform best when they feel calm and confident. Others, they may perform best if they're angry and they're overly excited or nervous. Everybody's different in this. But to find your ideal performance state, you need to be aware of what emotions really bring you to that best state. We used to work with and I refer to this in a moment, but with a trainer of Olympic athletes. And he used to tell the story that he had like a gold medalist who, in order to perform, he had to stress himself so much that he was very close to vomiting. So, but that's when he performed the best. I'm not saying that's what you should do. I'm just saying that it varies from individual to individual. So, and I do want to introduce also the importance our working memory plays in some of this because it does interfere with learning. So if you see how our performance, how we perform right? So as we learn a new skill, we go through the cognitive stage to the associative stage to the autonomous stage, which essentially means the cognitive stage, we're trying to figure out how to do what we're supposed to do. We do this all the time in surgery, right? So then as we practice more, we get better at the task and our performance increases, the blue line. But at the same time, what changes is that our ability to attend to other stimuli other than what we're trying to do also increases, which is depicted here by the green. The reason I'm bringing this to your attention is because stress affects this. It does essentially when you're under the stress, you move to a previous stage in learning, especially when it comes to the ability to have attentional capacity. And why is attentional capacity important? Because in addition to doing the procedure, you can also spare some attention to what's happening with the patient, what's going on in the room. You have better situational awareness, which we know is important, right? So you're less likely to miss things that are in front of you, that go through your working memory without even registering. And that can be critical to minimize complications. So it's important to recognize that aspect of stress also in your performance, but also if you work with learners, that affects them significantly here. Because in general, they're closer to the left side of the curve in the cognitive or associative stage, where they have very little spare attentional capacity, and they can easily be pushed to the point of not really knowing what else is happening. So that's where mental skills training comes in, and Dr. Lebarez referred to this. It's essentially a set of trainable mental abilities that underpin successful performance and learning. So they aim to help the individual achieve the ideal state that we refer to, the ideal mental and performance state, so they can always perform at the upper range of their abilities. A lot of us with experience may develop some of these skills serendipitously, not perhaps in the best possible way, and not perhaps all of them. But generally, those skills are underdeveloped in novice surgeons. So is it effective? You heard a number of things around this, but it's been shown that mental skills makes a big difference for elite athletes, for fighter pilots, for Navy SEALs, police forces. So it's used routinely in high-stakes environments and performers. And as Dr. Rial mentioned, we are one of them, but we don't necessarily routinely use this, and maybe we should. So we have developed a curriculum that addresses a lot of these strategies that help the individual optimize their performance. And our curriculum includes essentially a number of modules where our learners are exposed to and get practice on. We use simulation to implement a lot of this, but for example, we use mental imagery. And mental imagery refers essentially to thinking about a performance without necessarily doing it actively with your hands or legs. And that has been shown to make an important difference. Goal setting, there's no question, you got that also from the presentation about coaching. Goal setting is extremely important to improve your performance, but also energy management. And Dr. Real referred to some of this, like relaxation techniques. If you find yourself overly stressed, what can you do to bring your stress level down? But we have also the opposite, because it's not just relaxation. If you find yourself really devoid of energy, what can you do to actually bring your energy up without necessarily drinking coffee? So, management of attention. I brought to your attention the issues with working memory, spare attentional capacity. How can you learn to preserve that extra capacity and focus your attention in a way that you still can deal with all the stimuli in your environment? So, some refocusing strategies, I'll spend a little more time on this as an example, and also implementing some performance routines. I think performance routines. A routine, for example, for Dr. Real is the fact that she goes run, right? So then she gets in the car, goes and does the case. So she may take a snack. That's a routine, and the performance routine could be specific to the case you're going to do, or it could be something that really energizes you and gets you ready to go and perform. So the evidence of effectiveness, we've published numerous papers on this. I'm not going to spend a lot of time. I just will briefly share what we have found. So by implementing this, we have been able to demonstrate that we can enhance participants' both use of mental skills based on specific assessment tools that exist, as well as performance on simulators. We have also been able to show decreased perceived stress using validated stress tests, and one of them is what I'm doing now. Essentially, if you put somebody in a presentation mode, it's one of the most stressful events for any type of human. And you probably heard all of us presenting, including myself, our mouth gets a little drier, right? It looks like it gets stickier, and that's because the adrenaline goes up. So we've shown that that can actually improve that. We've also shown that the trainees that we train using these skills, they can maintain and retain some of the surgical skill better in the longer term. And more importantly, we've done a study where we took people who we train and we didn't train residents, and we put them in a very high stressful environment. That was in an animal OR that we tried to really stress them as much as we could. We couldn't do it in the human OR, obviously. And we did see that everybody's performance dropped when they got highly stressed. However, the people who we had trained with this curriculum maintained about 70% of their performance, while the control group, the performance became almost zero. So we do think that this works. We do have plenty of evidence that this works. Dr. Leberes presented some additional evidence in her work. So this is not something people refer to as soft skills. It can actually be very, very, very effective if you adopt this. So I'll show you an example of one of the modules.
If you have completed medical school, you have already demonstrated that you have exceptional intellect and knowledge. Surgery requires not only acquiring knowledge, skills, and abilities, but also being able to perform those skills and abilities on demand. There is always variability in performance. Even if your average is very good, there are times when your performance is relatively better or worse. The ideal is to improve your average and reduce the variability of performance so that your average is consistently excellent. The basic principles for accomplishing this are 1. Increase those things under your control that improve performance, and 2. Develop strategies to address those things not under your control that reduce your performance. From our research and experience with Olympic athletes, we know that there are a number of factors that are typically under a person's control that have tremendous impact upon performance. For optimal performance, you want each of those factors to be of the highest quality possible. In this series, we're going to focus specifically on the non-technical skills of surgical performance to help you perform at your optimal level in pressure situations. This includes both integrating mental skills as part of your ongoing surgical training, as well as developing specific coping strategies to address those situations where factors not under your control have the potential to create stress and impair performance.
So I'll give an example of cognitive reframing, which is one of the skills that we teach. And it is common, and maybe you can identify with this, that sometimes many of us have a negative self-talk, and we get into that cycle. I screwed this up. Oh my God, what am I going to do now? I had this complication. I'm going to tell the family, I'm terrible. Why did I decide to do surgery, right? So you get into this negative self-talk, which is not good for your performance. So there's techniques that we use that when you realize you're in such a situation, you need to break, right? So we use the trigger breath, which is like a quick exhale, and then followed by additional breaths that when you find yourself in that negative trance, you become aware and try to minimize that negative self-talk. But you have to develop specific scenarios that are reliable. For example, you're doing a laparoscopic cholecystectomy, and you realize that the resident you work with doesn't want to go for a break to have a snack, Dr. Real, so you're stuck and they're really slow and you have to finish and go to the boardroom or whatever for a very important meeting that you can't really miss or be late for, and now your adrenaline is going up, and what can you do, what you're going to do, so all this goes through your head and negatively impacts your thoughts. And what you really need to think about is, well, maybe I'll be late, maybe not. What I need to do is just focus on what I have now in front of me, right? Go step by step, and we'll see what happens. That's what's important. So get this out of your mind. So it has some wellness benefits because the negative thought patterns do, like all or nothing thinking or blaming yourself or catastrophizing or selective pessimism, they tend to negatively impact you also in the long term. So by reframing some of those thoughts can help you expose the negative thoughts and actually replace them with positive. For example, pessimism, right? It could be, oh, this always happens to me. But an optimistic view could be, oh, this is a one-time event. Or globally, I can't do anything about this. But an optimistic version of this could be, well, this happened for a specific reason that is modifiable. Or it's all my fault. Optimistically, you can say, well, things didn't really turn out so well because of circumstances that were beyond my control, perhaps, right? So by learning to substitute some of those behaviors that we find ourselves often into, you can essentially learn, and it goes without saying, practicing those skills. The more you practice, the better you get at them, right? Just one-time exposure is never good enough. So what do you need to implement a mental skills training in your program? You need a coach. It could be you, if you're a faculty member with an interest in this, once you get some specific training. You need a curriculum. Such curricula exist. One is ours. Dr. Barres presented another one. And there's other groups that have created some. You need some type of simulation, because it is good to learn to implement those skills on simulators. That gives the application of the skill. It's not just, like what I'm telling you now, you'll forget. In the next probably, I don't know, 30 minutes. But if you were to practice some of the skills that I just presented to you, you're likely to remember them a lot longer, right? So, and helping your learners to get into that habit is very useful. You need the evidence to support implementing this, because generally it is still considered something that most surgeons think, oh, this is too soft, right? So, but the evidence is accumulating, but there's plenty there that you can support your goal for this, to get the buy-in, both from the learners as well as from your chairman or whoever it is. You may need an approval to do this. And also useful, what we've learned in our experiences, having an app that people can use constantly to practice those skills, even outside of the coaching sessions you may have with them. So I'll conclude by saying that the undue stress can negatively affect your performance. I hope we provide you with enough evidence to make that point clear. Mental skills training can help optimize performance by regulating emotions and thoughts. And the current evidence suggests that such skills are effective, and training are effective in accomplishing your performance improvement. So consider incorporating that such a type of training into your programs. Thank you.